So, hi everyone. Today I'll be talking quickly about the opportunities and challenges of blending online and offline social listening of infodemics. I'm Leonard. I work at the Institut Pasteur. I'm an anthropologist. Next slide, please. So I'll start with discussing the way that we approached online social listening. So the idea for us was to characterize online discussions about the virus, the vaccines, and the interventions, and the way that we approach rumors, conspiracy theories, misinformation, is to take them seriously. And as Kaler said about rumors regarding fertility, rumors regarding vaccines, is that rumors are more than simply stories which are not true. They tell you a lot about the deep-seated mistrust and the issues that you need to resolve before you want to increase uptake. So the idea is understanding the concerns so we can start having a dialogue, so we can foster trust and in the end favor uptake, including of the vaccines. Next slide, please. So just to give an example, this is an overview of a vaccine social listening report from last week. Using online and interview data. This is for Belgium, Flanders, and it was made by Charlotte Griezels and Stefan Dillon. So I won't go through all of it, but it gives you a picture of the different types of vaccine controversies that were characterized during the week and the sub concerns that each have. So you have some regarding the indirect mandatory vaccination passports, the role of the media, including in creating negative images of vaccines and so on. And so these overall mapped out controversies of the week, they give you an idea of the things that you would want to address from a communications point of view, so you can go on into the dialogue. Next slide, please. So the way that we do it is for the qualitative characterization of narratives is the classical way in qualitative analysis, that we just extract tweets and Facebook messages through the servers and the API, and we extract them as CSV text unstructured data, and we import it into qualitative analysis software such as NVivo, and we start characterizing with a set of predetermined categories. Next slide, please. So another way to deal with this massive information, because it's usually millions of messages, is to run some simple statistical analysis, for instance, of hashtags, which are really interesting because they're user-generated labels. And so, for instance, this is an example from France, and you see the top hashtags concerning the vaccines, concerning the vaccine passports, concerning the different variants. And so it gives you a hint of the different types of concerns that you may have this week. Next slide, please. So another way is you can also go through your big data by trying to track different types of words, of grouping of words, and for instance, the different mentions of the vaccine, so you can see which are the vaccine that is most discussed today, and so you go and dig deeper into the kinds of stories that are being unrolled about specific vaccines. Next slide, please. You can do the same with once you have characterized your different types of concerns, you can make a list of the specific words which are related to those concerns using text mining techniques or machine learning, or even noting down from your frequency of words of different categories of text that you have categorized. And so you can plot day by day or week by week the variations in those concerns. So we see here that for this list of safety concerns, we had a big surge of thrombosis-related concerns in March and April. But earlier we had more nuanced also types of concerns. Early on, it was about the interaction between allergy and the Pfizer vaccine. There was also fertility concerns ongoing with the different types of vaccines. And so this is also useful as you go week by week to have an overview of, okay, so what is the flavor of distrust of this week? Next slide, please. And so you can combine your synthesis of qualitative analysis and your plots into online dashboards or into social listening reports in documents and share them with stakeholders. Next slide, please. So that was for online social listening. So now I'll talk a bit about offline social listening, how to triangulate this information, because the issue with online data is you don't really know who's talking. It may be a bot. You don't know what is the prevalence of the different kinds of claims, because some people talk a lot online, but they may not be what they say may not be representative of the way people think in real life, and we don't know the types of impacts of those claims and narratives that they have on real life. So I'll just show 3 ways that we tried, among many other groups, we tried to determine the impacts of infodemics and to ground our data and to use the combination of this data to help during the pandemic. So next slide, please. So the first project is the Transvaxx Consortium project, which it's a consortium with ITM, Kaler, Leuven, Heidi Larsen's project of vaccine confidence project at the London School of Tropical Hygiene and Medicine and Institut Pasteur. And what we've been doing since November 2020 is to produce a bi-weekly newsletter of vaccine concerns, which is based on the online social listening, but also on in-depth interviews with healthcare workers, policymakers, hesitant and confident lay individuals, mostly from specific groups, from youth and underprivileged communities. And to discuss those, we also had monthly stakeholder meetings to discuss the most pressing concerns, ongoing narratives, rumors, and to try and co-create strategies to address them. And we're also setting up what is called living labs, which are empathic and safe places for lay individuals to discuss our study results and balance expert knowledge and our own biases and try to co-create ways to build trust with specific groups. Next slide, please. Another project that we had is with the European Union Recover project. And so the idea was to use a social listening that we carried out a year ago to identify early narratives and claims regarding COVID, vaccines, and treatment molecules, and to adapt the survey to try and measure public trust towards health authorities, scientists, and vaccines and treatments, and also of the prevalence of given identified claims. So for instance, authorities want to insert microchips in the COVID-19 vaccines to impose control over people. That was one of the conspiracy theories that we had identified early on. And through the survey, we found that between 11 and 20% of the participants in the European countries agreed with the statement. Next slide, please. So we also had, of course, the question of whether you would take a vaccine, a safe and effective vaccine. And in December 2020, we had some low answers. Mostly, the lowest was in France, with only 44% who were willing to take a vaccine. What is interesting is that we also included a qualitative component to this. So not only are we asking, are you taking the vaccine, yes and no, to a representative sample, but we're also asking the written rationale for their decision. So if you take France, for instance, we had 28% who refused the vaccine, but by analyzing qualitatively, we also determined that 40% of those refusals were actually conditional. So people were saying, I'm not taking the vaccine, but if in a few months I see that people around me took it and nothing happened, or if other countries took it and nothing happened, then I will revise my decision, which is huge. And even among those who, the 44% who accepted the vaccine, 12% expressed conditional acceptance, like, I'll take it, okay, but I kind of need to be more reassured about the safety of the vaccine. So beyond the notion of vaccine hesitancy, we see that at a given point of time, people are actually already showing and are showing that their decision is kind of volatile. So in December 2020, when we conducted this study, we quickly saw that the major concern was with the vaccine development process, that people were perceiving that it was still being experimental and experimented upon them. But we also saw a very positive thing, which is that even among those who refused, there was the possibility that they would agree later on if we made visible the vaccination of the first who would agree to get vaccinated, if we recreated kind of visible networks of trust towards the vaccine in real life, right? Of the social circles of people who were hesitant. Next slide, please. So another project is one we had with and we still have with the French Red Cross. And the question that we asked is how do narratives about the virus and mass vaccines influence Red Cross actors in their protective behavior on the field and on their willingness to engage in the field in the first place during a pandemic. So we used online social listening, key informant interviews, and also quarterly surveys. And we found that there were very lasting effects of contradictory information on trust. So, for instance, the mass debate is still being referenced to a year later as a reason why some have doubts now towards authority decisions, either Red Cross or the government. We also found out many individual and group coping mechanisms, including like shutting off of Facebook, the TV, newspapers, and just going on the field and just locking out all kinds of information to deal with the type of uncertainty and anxiety of going into the field. And we saw a lot of debates on equity of access to protective devices, masks or vaccines, and of risk exposure. Next slide, please. And so, well, this is under review, but we found many ways in which the infodemic, coming from what we call the information ecosystem, which is social media, newspapers, TV, and so on, is actually interacting with a lot of other set of social and cultural factors, social familial relationship and obligations, gender expectations, financial pressures, co-worker relations, and so on, to shape the perceived risk and the moral obligations of acting, and shaping the decisions to return or not on the field, and to wear or not a mask, to get vaccinated or not, and so on. So we try to show this complex interaction of enablers and barriers of infodemics within the social life of the epidemic. Next slide, please. So some remarks is that online social listening is accessible, fairly accessible, and grants valuable knowledge to foster adherence to public health intervention in the midst of infodemics. But online social listening is thin and should, as data, it's kind of thin, and it should ideally be complemented with grounded data for triangulation and to measure impact. And the concerns that people have evolve rapidly. They have a short lifespan. It's a bit like mayonnaise. It's good and it's easy to make, but it only lasts a few days. So you need a close collaboration and to be embedded with operations so that what you discover is useful. And so in this sense, the notion that there's a system such as the WHO EARS is a really good news in the field to facilitate access to social listening for stakeholders, including those with limited programming resources. Yeah. So thank you very much for listening, and I'd be happy to discuss this further. Thank you.